Hi, my name is Sarah Salajic. I am the Care and Outreach Coordinator here at NF Midwest, and this is Meet the Faces of NF Care. This is where we focus on highlighting NF clinics in the Midwest, and today we are lucky enough we have Children's Wisconsin with us. We will go ahead and get started by doing introductions.
Thanks for inviting us to join you today. My name is Donald Basil. I'm a medical geneticist and one of the co-directors for the Neurofibromatosis and Rasopathy service at Children's Wisconsin. Before we introduce the rest of the folk, I'm just going to give you a brief background. We've had the clinic running for multiple years. I was recruited in 2010, and the clinic was well established since then. One of the reasons I wanted to give you this preamble is we've gone through a number of changes, and a lot of people often ask about who is NF. And the people you see here today are sort of the core group of people who are the people who coordinate most of what happens with the NF clinic. But as Katie will tell you in a while, it's definitely not all that is made up. So I'm going to hand off to Dr. Layler.
I'm Leah Layler. I'm one of the pediatric dermatologists at Children's Wisconsin, and I am the dermatology person who comes to our NF clinic. And so I evaluate our patients within the clinic and help them with their dermatologic concerns. Additionally, outside of the specific neurofibromatosis clinic, I evaluate patients in my own regular pediatric dermatology clinic, along with many of my colleagues, or people who are referred to us with concerns about whether or not they may have neurofibromatosis or another genetic syndrome that could be best served within our interdisciplinary clinic.
My name is Kristen Griffiths. I'm one of the genetic counselors in our NF clinic. As a genetic counselor, my role is to help gather history information during a visit, provide education about NF, including genetics and inheritance, and discuss genetic testing options.
I'm Katie Canavy. I'm the clinic coordinator and a registered nurse for the clinic. I consider myself to be kind of like the guy in the chair in movies. So when you make your plan with Dr. Basil, Dr. Layler, any of the genetic counselors or other team members, I'm the person who tries to make sure that stuff is happening. So oftentimes I'm working behind the scenes to help schedule appointments, wrap up appointments. I'll take your phone calls and that sort of thing.
The first question we had was, are there additional people in your team who are not here today?
We do actually have a pretty large team. Not only would you meet the providers you see today, but there are two other nurse practitioners and a physician assistant. These are advanced practice providers in genetics with special experience and focus in NF care. We also have 4 other genetic counselors whose role is really similar to Kristen, which she outlined very well. We also work with a great team of medical assistants and front desk staff who keep the clinic going. And then more broadly, we do coordinate with other specialties in the hospital. That might include things like oncology, neurology, radiology, ophthalmology. So while we don't see the patients together with them, we do work closely with them to ensure quality care.
Could you tell us a little bit about what a first visit at the clinic would look like? Would we see multiple doctors at one visit? Or would that be broke down into a couple different visits?
At the first appointment, patients will see a genetic counselor, one of our genetics providers, so one of those advanced practice providers, or Dr. Basil, and then we'll also see Katie at the end of the visit, and then Dr. Layler does see some patients for the first visit as well. And then during the visit, once a patient is roomed, the genetic counselor typically meets with the family first to get some medical and family history information, as well as discuss some of that education about NF and genetic testing options. The providers, if Dr. Layler is involved, typically see the patient next for some of that additional history information, as well as the physical exam and recommendations. And then Katie wraps up the visit by reviewing the after-visit summary and the next steps.
If people are expecting a quick in and out, these are not 15-minute visits. They often take an hour, sometimes even longer. And the reason we do that is so that we can really take a close look at what healthcare needs you have, so that we're making sure we attend to everything that is necessary from an NF perspective.
Is it kind of encouraged for patients to continue with their primary physician as well as specialists at the NF clinic?
We definitely look at everything, but we really see ourselves as partners with the primary care physicians. There are multiple healthcare needs which are beyond the scope of what we do at the neurofibromatosis clinic, simple things like vaccines, everyday illnesses. Those are the sorts of things that really need your primary care. So having a very strong and good relationship with your primary care provider is key for your general health needs. And we're there to help with the subtle nuances that make things slightly different from an NF perspective, and especially if there are NF complications.
Could you tell us a little bit about your location and days of the clinic and hours?
We are located in the Children's Wisconsin Milwaukee campus. We are in a brand new building called the Yabuki Tower, and our clinic is always on Wednesday. At this time, we don't have any satellite locations, so we do ask that you make the voyage to Milwaukee. And our clinic usually starts at about 8 a.m. and our last appointment may be as late as about 3 or 3:30 p.m.
Could you tell us a little bit about age range of your patients and even what transitioning into adult care would look like, and if you have an adult NF clinic that you would refer to?
The majority of the patients we see are children, but we do follow established patients into early adulthood, and we'll occasionally see adults if they need an initial evaluation to diagnose NF, but we don't follow them long term. Patients can transition to an adult NF provider at 18 years of age, or they can choose to delay that transition for a couple of years. If a patient attends college, we often follow them through their college years and transition to an adult provider once they graduate. When a patient is ready to transition, we provide contact information for the neuro-oncology clinic at Froedtert in Milwaukee. There are two main physicians there, Dr. Connolly and Dr. Santos, who see our adult patients with NF.
That sounds like a nice smooth transition. I like those. All right. And do you guys have any research that you're currently conducting or you like to share?
We do have something called the photodynamic therapy, or PDT study. This involves teens and young adults, and it's a potential therapy for neurofibromas. The study uses an experimental medication that's applied to the skin, and then it's exposed to a special red light with the goal of shrinking the neurofibromas over time.
That sounds exciting. What do you think your biggest strength is? Your clinic's biggest strength?
I think it's the teamwork. We have a large team. We speak to one another. We're collaborative. And because we have an extended network, as Katie alluded to, with the specialties that you might not see in person, we have the ability to create a rich environment of practitioners or specialists who have expertise in neurofibromatosis. So the ophthalmologists, our radiologists, our neurologists, our orthopedic surgeons, if you think of all the subspecialties that you may encounter with some of the complications, the rare complications that can happen with neurofibromatosis, individually, those providers are not going to stumble across patients and get experience. But because we tend to work with the same set of providers on a regular basis, we've established an institutional experience with neurofibromatosis in managing some of those more complex patients. So I would say that's probably our biggest strength, that we do have this interdisciplinary collaboration that it allows for the expertise to be shared to the benefit of the patients.
Before we move on to questions from the members, is there anything else you'd like to share with us?
Just that we do have some opportunities. For example, our clinic has just restarted participation in something called Rainbow Camp, which is an annual day at a day camp where people can do all sorts of fun childhood kind of activities. And we invite a lot of individuals that are school-age, teenage with neurofibromatosis and a couple of other genetic conditions. So it's not necessarily NF focused, but it's a great opportunity to meet other individuals with NF and just have a really fun day.
Yeah, that sounds great. Okay, I think we'll go ahead and take some questions that our members submitted through a survey that was sent out. So the first question is, are there certain medications that they should avoid if a person has NF?
It's a good question. I think there's a lot of rumbling and anecdotal experiences that I've heard from patients. Things like oral contraceptives, things like medications that impact seizures. There's no specific contraindication to any medication based on the diagnosis of neurofibromatosis itself. I think the biggest caution we have is when we really come to treating cancer. We don't like using radiation because it increases the risk of additional cancers. So in the broad context of using medical management, I would say radiation is one of those, but that's not something a patient's going to easily come across unless they already have a cancer that's being treated. People often think about growth hormone. There is a slight increased risk for tumors in the brain associated with growth hormone therapy. That doesn't mean that we shouldn't use growth hormone. For patients who have true growth hormone deficiency, that is an essential treatment. So we often have to look at what we need to do with awareness that there can be rare risks associated with that.
What kind of lump is more concerning, a soft or a hard?
Generally, that can be a tricky question to answer because I'm not necessarily sure about what the context is of that question. But for the most part, a harder lump is more concerning, particularly if it's growing quickly. Most neurofibromas are really quite soft, even to the point of being able to push them completely back into the skin. So a hard lump would certainly be surprising and something to bring to the attention of your doctor. Though, generally speaking, if there's something that's growing on your skin or in your body that you are worried about, that feels different to you, or otherwise just is not something you're feeling comfortable with, bring it up to the team. We can always help.
How does someone best communicate with their doctor if their doctor seems to think that most things are related to their NF?
We see this in a lot of rare genetic diagnoses where sometimes unexplained symptoms or any symptoms at all are just pushed off to that particular diagnosis. My recommendation would be to make sure that your doctor understands that you are not defined by your diagnosis and that your healthcare needs are the same as the general population, and that not everything necessarily needs to be related back to neurofibromatosis. And if there are questions, we are more than happy to speak to any primary care physician to help them address certain concerns that they have.
We had questions about if your NF clinic works with family physicians or primary physicians to kind of help give them a little bit more insight into that NF. And it sounds like you work very good as a collective team.
We do. We have handouts that we have prepared for education across the board for other healthcare workers. We as a clinic unit have provided education opportunities for primary care providers. We've put together several conferences that were focused educating primary care providers. We haven't done it since COVID, but pre-COVID we definitely had a few of those. And then all of us frequently get MyChart messages or Epic messages from various providers related to the care so that we can help manage specific questions as they relate to NF and the care.
Is the temperature in a child with NF more concerning than what it would be in a child without NF?
Not specifically. So the big thing about temperature is whether there are seizures that are pre-existing or not. Febrile seizures, which are seizures that can happen in the context of a fever, are more likely to happen if you have a predisposition and there's a rapid change in temperature. So if you happen to have a predisposition to having seizures and you have a rapid change in temperature, a rapid rise in temperature, you could have a febrile seizure that could be triggered by that fever. But otherwise, I would treat a fever in a child with neurofibromatosis pretty much the same as any other child.
Should I be concerned about my teen taking birth control because of the hormones? Does it affect children with or adolescents different than a child without NF?
It's another great question. It's one that I hear frequently at conferences or concerns that are brought up during patient visits. The truth is that there's not much data out there. There was one study in Germany that looked at a large group, 60 patients who had neurofibromatosis. They concluded that oral contraceptives didn't impact tumor growth. They only had 2 patients who were reported changes when they were on depot. I think that's too few patients and too small a number to make any conclusive decision that hormones emphatically change or put you at risk, because there are hundreds of people out there who are on therapy and we just don't have the data. What we do have data about is the changes in puberty that impact the growth of tumors. And there was a recent study from, I don't think she was the primary author, but Dr. Wiedemann done at the NIH. She was part of the author group, and they concluded that the hormonal changes during puberty did not impact tumor growth at all. So the same can be extrapolated for contraception.
How likely is it that neurofibromatosis appear later in life, say even like after pregnancy? And so if you don't really have many as a young child, what is kind of the chances that you'll develop one in adulthood?
This is quite a big question. So it's going to take me maybe a couple of minutes to answer effectively. But neurofibromas on the skin typically develop in adolescence or around puberty. Around 95% of people with neurofibromatosis will develop neurofibromas at some point. They form because that NF1 gene encodes a protein that helps control cell growth. And so when it is altered in neurofibromatosis, there can be continuous cell growth, particularly in cells that come from nerves. There's a complex push and pull between continuous growth and stopping the growth of cells within the body, but usually around puberty, the cell growth wins and neurofibromas develop. Importantly, there are many factors that can affect the development of neurofibromas, including when they appear, how big they are, how many there are, how fast they grow, and how they look and feel. Researchers are still trying to figure out all the different factors that contribute to all those things, but some of them include hormones, as were being discussed, the type of pathogenic variant in the NF1 gene that any person has, other modifying genes that can affect that, skin trauma, sun exposure, and maybe even heat. There has been some research on heat affecting neurofibroma development. So to try to answer the question, I would not say that it's common for people with neurofibromatosis to develop neurofibromas later, like much later in life, or only after pregnancy, though everyone with NF is affected differently. Many people with neurofibromatosis have very few cutaneous neurofibromas, and researchers are still really trying to work out exactly why this is.
Yeah, I think that's all we have for member questions. If anyone has anything they want to add.
I'd just like to thank you for this opportunity, as well as the Midwest NF community for placing their trust in us at Children's and allowing us to share in the management of their children. We're here to improve, to constantly sort of keep up with the latest therapies, and really our main goal is the health of the child and the family. So yeah, thank you.
Thank you all for being here today, and thank everyone for watching our recording. If you have any questions about NF Midwest or Children's Wisconsin, we will have that information at the end of this video. So thank you so much. See you next time.